This is Warren Science. It's time to start our pig heart dissection. In your pan, you should have the pig heart, a scalpel or razor blade, probe, pointer, and tweezers. While someone in your group is rinsing off the heart, take a moment to review the external anatomy of the heart and compare it to the one in your pan. Your heart should be in the pan with these structures in view. You'll see the auricle, which means ear flap, right and left. This is the right auricle. And then you'll see the pulmonary trunk right here. Remember, that is what is going to the lungs. And then if you turn it around to the posterior side, you'll still see the auricles. You can see I'm holding them down here. And then you'll see, again, the right and left ventricles from the back. Now, you guys may or may not have to do this, but I cut a little bit of the tissue away. You can see there's a bunch of fat there so that I could see the vessels a little bit better. But if you can see them clearly, then you don't need to cut. Basically, because these hearts were vacuum sealed, it may be easier to identify the vessels once you're inside the heart. So go ahead and stick your probe down one of those holes and see where you go. So now that you've done a little bit of exploring, now we're going to make our first cut. This is a coronal cut, and you're going to go all the way around the heart. So what I suggest is that you make a thin line past where you are so that you have a line to follow so that you don't get off track as you're cutting. You'll notice now I'm at the apex of the heart, and I'm going to continue around to the other side. This is not the time to make shallow cuts. You have to go deep into the heart. Remember, the myocardium is thick, and when you think you're inside, you're probably not. So keep on cutting. You can lift up part of the heart as you're going. Maybe have a member in your group hold one side while you're slicing through the other. Now remember, while I'm cutting, you should be cutting as well. And you should be able to notice that you're getting inside the heart because the consistency from the myocardium to the ventricle walls is a different consistency. You can tell that one part is very smooth while the other part is very thick. Now you're starting to see the right and left ventricles appear. Now might be a good time to pause the video and see if you and your group members can identify some of the internal structures. Okay, so your group should have been able to label the bicuspid valve held by these strings called the chordae tendineae, and those are the tricuspid valves over on the other side. 3 cusps, remember, versus 2. The chordae tendineae are extremely strong. Go ahead and try to break one with your fingers. Then go ahead and cut a little bit more of the myocardium. You remember, you want your heart to be like an open book. Throughout the entire dissection, if you're ever not sure where you are, I highly recommend sticking your finger through the hole and seeing where it goes. You can see that this one is going to go up to the aorta, so you know which side should you be on. Did you say left? You were on the left side. Now you can see some of the semilunar valves. Remember, those lead up to the aorta or to the pulmonary artery. Okay, time to check again. Where are we? I'm gonna stick my finger through the hole. You do it too. I'm gonna go up and I should be, yep, I'm in the right atrium. Remember, the chamber on the inside is the right atrium, but the flaps are called auricles. Now keep cutting again until you have your open book. What you have a really good shot of right now is the right AV valve, the tricuspid valve held with those chordae tendineae. And the chordae tendineae are held by these papillary muscles. They're very strong, thick muscles found in the ventricles. And only the AV valves have the chordae tendineae. And on the left side, we see our other AV valve, the bicuspid or mitral valve. Okay, now we're going to take a look at the right and left atrium. So this is the left atrium. This one is cut open, and then this is the right atrium. You can see that the chamber is smooth on your way up. You might need to stick your finger up there so that you know you're in the right spot. Okay, now this part might be a little tricky depending on the heart that you have. So trying to find the pulmonary artery and vein may be a little bit difficult. You want to use the aorta as a reference point, and then you're looking at the posterior section of the heart. Behind the aorta, you should find the pulmonary vessels, and below that, going into the atrium, you'll find the superior and inferior vena cavas. There's the aorta right there. And like I said, in some of these hearts, for example, the pulmonary veins might be cut. The superior and inferior vena cava is most likely cut off as well. Again, remember, veins are going into the atrium. So make sure you're looking for a connection to the atrium. Again, remember there are a lot of holes, so put your finger in there. See where the hole actually goes to help you understand which artery or vein you're actually going through. So you can see I'm putting my finger in there, and to be sure, I'm going to cut the atrium, okay, and see what actually goes to that spot. And after you cut it open, go ahead and pause and take a look at the inside of the atria. And after you're finished with this, you want to make sure that you have completely cut the two sides open of the heart, as shown here. Take a look at the structures and note them. So in the left side of your pan, you should have the posterior or dorsal side of the heart, and on the right side, you should have the anterior or ventral side of the heart. So just to check your work, pick up the posterior or dorsal piece. You should be in the right ventricle, moving up to the right atrium. Are you in the right spot? Okay, now we're going to do our final cut. So go ahead and put your heart back together, and you are going to make a transverse cut on one half and then make that same transverse cut on the other half. I'm speeding this up because you know how long it takes to cut myocardium. It's very thick. So go ahead and do one side, put it back together. You should mark your other side to make it even, and then go ahead and cut down through the other side of all the myocardium through the chambers. So after you're finished cutting, go ahead and put the two pieces back together, and what you're going to be looking at is the very thick left ventricle and the very thin right ventricle. The left ventricle is thick and circular, and the right ventricle is a lot thinner and more moon-shaped. Basically, the right ventricle kind of cups the left ventricle like a glove and a ball. Okay, everybody, we are finished with the dissection, and it is time to clean up. Thank you so much for watching Warren Science Pig Heart Dissection.